Hello, this is Dr. Grande. Today's question is, what is social communication disorder? This is also known as pragmatic communication disorder. And with social communication disorder, we see a deficit in the ability to use nonverbal and verbal communication for a social purpose. So there's deficits in communication for greetings, sharing information, and doing so in a manner that's appropriate to the social context. We also see trouble matching the context for the place, for the person, and for the formality. So for example, for place, an individual with this disorder may use a style of speaking, of communicating, that doesn't change between the library and the playground. So the context for place really isn't matched. For person, they may speak to an adult the same way they speak to a classmate. Again, it's not recognized in that context. And formality is another area where we see a deficit. So the individual may use informal or formal language when the other type of language would be more appropriate. We also see with social communication disorder, there's difficulty understanding and following the rules of conversation and storytelling. So rephrasing something that's misunderstood, or taking turns as people are telling their story, and regulating the flow of the conversation using verbal and nonverbal communication. With social communication disorder, we also see deficits in understanding what's not explicitly stated. So metaphors, inferences, humor, or idioms could be challenging for somebody with this disorder. It's important to understand with social communication disorder this idea of pragmatics. So we're talking about the social use of communication, the context, and the give and take that we see when communicating with other people. This is not a matter of mechanics. It's not a matter of correct grammar or sentence structure. It's a matter of pragmatics, that social use of communication. There are a few differential diagnoses for social communication disorder. I think that the main two that get confused with social communication disorder would be autism spectrum disorder and social anxiety disorder. There is an overlap in some of the symptoms between autism spectrum disorder and social communication disorder. One of the key differences would be the restricted interest and the repetitive behaviors would not be present in social communication disorder. As far as social anxiety disorder, with that disorder, we think of the communication skills as being fully developed, but not being used because of fear and anxiety. Whereas with social communication disorder, we think of the skills as never having been developed. I hope you found this video on social communication disorder to be interesting. Thanks for watching.